with The Web That Has No Weaver. This is a pretty quick one. I just want to go back to, I can't remember the page number now, page 16, 17, the section that talks about art in China. You know that I've talked about how Taoist thinking, naturalist thinking sort of underpins everything, and this section refers to that. The whole idea of art as a microcosm, as a way of expressing balance and beauty and harmony, those are the same notions that are applied to traditional Chinese medicine, how we look at health, balance, harmony, and keeping in mind the idea of human beings as a microcosm. Landscape painting was also a microcosm, and just to emphasize from what Kapchuk says in his book, The Web That Has No Weaver, in it are contained all the elements of nature, and it serves as a model of the cosmic process. So if you have the chance this summer, when you're out and about, if you're interested in going to art museums, Peg, this might be for you. The MFA in Boston has some good Asian art. Better than the MFA, I think, is something called the Peabody Essex Museum in Salem, Massachusetts. It's got a great Asian art section, and most importantly and interestingly, it has an actual Chinese household that was dismantled in China and brought to the United States and reassembled exactly as it was in China. And it tells the whole history of the house, the history of the family in the house, and you really can see these ideas of human beings as a microcosm of nature in this house and the art that you see in the house. And the house itself is art. It's pretty cool. So I mentioned a minute ago that for Chinese thinkers, the idea of a microcosm shows up in, as we've talked about, in traditional Chinese medicine and then also in art. And just to pull out of Kapchuk, I guess it must be page 18, in each person, as in every landscape, there are signs that when balanced define beauty or health. If the signs are out of balance, the person is ill or the painting simply does not work. So in the West, we always talk about medicine as being science. And I think it's worth kind of highlighting that although Chinese medicine definitely is internally logical, it makes sense, it's its own system of thinking, it's not art per se, although it has a lot of the same sensibility, a lot of the same sort of approach that Chinese art would take, but it's not science either. Not science certainly in the way that we know it in the West, you know, the double-blind, randomly controlled, placebo-controlled experiments. It's not the same thing. It is a pre-scientific tradition. It's thinking that just sort of eludes science. And that's one of the challenges with doing good research in traditional Chinese medicine. Sort of anecdotally or empirically, we know it works. There's a bazillion stories that say that it works. But in the West, that's not good enough. We want the randomly controlled experiments, and Chinese medicine does not lend itself to that really any better than massage does. So if we're going to do science, we're going to talk about science. You know, it's important to have ways of measuring and ways of assessing. And Peg, again, you asked this in class the other day, how do you know if the client is getting better? What are the measurements? So the measurements allow for description, they allow for diagnosis and treatment, they allow for creation of a pattern, creation of a picture, if you will, a painting, if you will, of the client, but they're not the same kind of quantitative measurements that we would use in Western medicine. They don't care about measuring the numbers for blood pressure and heart rate and pulse and oxygen saturation. They do care about talking about how the client looks and what the client's pattern is. So on page 19, Chinese medicine is not primarily quantitative. Again, they don't care about the numbers that would be so important to Western medicine. The blood counts, white blood counts, red blood counts, hematocrits, enzymes, all those things, all those are their numbers. That's it. They're just numbers. Chinese medicine really doesn't care about that. They care about texture and image and balance. There is no standard or absolute. What is health for one person may be sickness for another. So I just want you to, in your work with your clients in the clinic and on your own, just sort of think about how the artist's eye can help you to have another way of seeing your clients and seeing their health or lack thereof. There's actually a movement in a lot of American medical schools to take medical students to art museums and have them study art as a way of developing their observation skills, as a way of developing their intuition about what they're seeing, as a way of looking closely at their clients. Now, they're not turning their backs on the blood pressure and the heart rate and the cholesterol in the blood, but they are adding it to their toolkit. So there's something really valuable about seeing your clients as art, seeing your clients as a picture, as a texture, as a flow, what works and what doesn't. So as you're doing your work, I could say this week or the rest of the summer, or I guess I really should say for the rest of your careers, think about who looks healthy and why, and maybe who doesn't especially look healthy, but there's something about them, an inner spark that makes them seem healthy. And regardless of the way somebody looks or what your impression of them is, who really is healthy? So people can look healthy, they can seem healthy, or they can be healthy, or some combination of all of those. So open your eyes and keep your awareness alive so that you can see your clients with an artist's eye, just the way a Chinese artist would see a landscape as a picture of balance and a Chinese physician would see a patient as a picture of balance or imbalance.